Hello, my name is Jordan Casper, and I'm a student physical therapist at Augusta University, and along with Vincent Adams, Jenna Bayne, and Joey Lim, we will be discussing the interactions between speech-language pathologists and physical therapists. So just a general brief overview of our presentation, we will first look at the educational background and professional training that's required to be an SLP. We will look into the licensure and certification process. We will discuss duties, responsibilities, and skills that are necessary to practice as an SLP. We will look at the interaction with physical therapists, discuss current issues within the profession, as well as look into direct access. So first, the educational background. Students must require a bachelor's degree, and that's usually gone through the route of a communication sciences and disorders major. However, any major is acceptable. After that, a master's degree must be acquired, and that's usually 2 years of full-time study. And then this curriculum is usually based on academic and clinical prep, involving communication and swallowing. Following that, a clinical fellowship is usually performed, which is just 1 year of supervised practice, and this is necessary before you can be certified. So, common curriculum that's hit on in undergraduate programs are biology, human anatomy and physiology, linguistics, and then other sciences such as neuroscience, psychology, as well as cognitive science. So for our project, we had the opportunity to speak with Mrs. Sarah Blackwell. She's an SLP who works for the Douglas County School System and has for the last 13 years. She told us that she received both her bachelor and master's degrees from the University of West Georgia. She said that her observation hours were mostly done in clinical settings, however her practicums were usually performed in the school system, and that the focus of her curriculum was more educational rather than clinical based. So for our master's degree, there are more than 300 colleges and universities in the U.S. That offer such programs. Within our state, there are actually 3. The University of Georgia, the University of West Georgia, and Valdosta State all have programs. The ASHA, which is the American Speech Language Hearing Association, requires at least 400 hours of clinical practicum and observation, and these schools receive accreditation through the Council of Academic Accreditation in Audiology and Speech Language Pathology. So common coursework that is in the graduate level programs are diagnostic and clinical methods in speech language pathology. They study speech sound disorders as well as fluency, voice, and resonance. They look into the assessment of linguistics and literacy. They'll study dysphagia, which is difficulty with swallowing, as well as look at alternative forms of communication for those who have issues with their speech. So next, we'll turn it over to Jenna, who will talk about the licensure and certification process.
The American Speech Language Hearing Association's Council for Clinical Certification in Audiology and Speech Language Pathology offers the national certification for SLPs, and all 50 states, including the District of Columbia, require license to practice, except in settings that are exempt from licensure, which would be in school setting, and a certificate for clinical competence in speech language pathology is required for healthcare and private practice settings. However, in school settings, only a teaching certificate is required for practice. So our interviewee first worked in the school system for 9 years and then applied to ASHA on her own to receive her clinical certificate of competence. And one must have liability insurance if they're not working within the school system. So there are a variety of different employment settings, including education, healthcare, and private practice. So over half of SLPs are employed within the educational settings, which includes preschools K through 12 and then higher education, such as colleges and universities, and around 40% of SLPs are employed in healthcare settings, including both short and long-term healthcare facilities, as well as residential and non-residential facilities and hospitals. And then less than 10% of them are employed full or part-time in private practice, and this is nice because they're able to make their own caseload schedules how to facilitate reading or asking questions, talking in different ways to suit the listener, and following conventional conversation rules. One can have problems organizing their thoughts, paying attention, and remembering, which is a more cognitive side of it. And then there's also oral rehabilitation for individuals who are deaf or hard of hearing, and individuals who wish to modify their accent. And then they also work with feeding and swallowing, patients with feeding and swallowing difficulties, which may follow illness, surgery, injury, and commonly stroke. All individuals with autism spectrum disorder have social communication problems. Social communication disorders are also found in individuals with other conditions, such as a traumatic brain injury or TBI. And cognitive communication disorders usually happen as a result of a stroke, TBI, or dementia, but they can also be congenital. So now I'm going to hand it over to Vincent to talk about the duties of an SLP.
So today I want to talk about the duties of a speech-language pathologist. So an SLP works with a full range of communication disorders, and they have several different duties. So the main role of a speech-language pathologist is to diagnose and treat individuals who suffer from stutters, as well as vocal and cognitive communication impairments. They treat individuals of all ages, and they utilize an individualized plan that encompasses both long-term and short-term goals. And these goals are based on the patient's individual needs, so they're going to be different for every patient. During treatment, there's a variety of different qualitative and quantitative assessment methods that we can use in order to analyze and diagnose the nature and extent of the impairment. Then these can be used to make better short-term and long-term goals for a patient. And an SLP generally adopts a team approach, and what they do is they'll develop individualized family service plans, as well as individualized educational programs for their patients. And so the individualized family service plan has several key components. The first is the people and the organizations involved. The second is the current levels of functioning, which may include medical conditions, vision and hearing exam results, cognitive assessments, and then communication abilities. It also includes family information, the services that will be given to the client, and the outcomes expected for those services. So the IFSP is a written treatment plan that maps out the services for your child that your child will receive. It says how long your child will receive these services and exactly how they'll be administered. It details your child's current level of functioning, and then it says the specific needs and goals for treatment. So IFSP takes a family-based approach. It's developed with input from the child's family. And once the child is deemed eligible, an IFSP team will be put together, and they'll develop a treatment plan for the child. So an individualized family service plan applies to children from birth to 3 years of age. And then once the child turns 3, we have to switch over to an individualized educational program, and then that's put into place. And the IEP is created through a team effort, and it's reviewed at least once a year. So we had the pleasure of talking with Mrs. Blackwell about her responsibilities as a speech-language pathologist. And she found that as a school-based SLP, because she worked in the elementary level for 13 years, she had many different responsibilities. So she was responsible for a caseload of students who already had IEPs set in place, and she was also responsible for putting IEPs in place for new students and determining who's eligible to receive speech treatment. And in regards to the skills and knowledge that she felt she needed while doing SLP, she had the opportunity to work in both clinical and school settings. She found that the use of her skill set varied based on location and situation. While working in school and clinical settings, she found that she had to value patients in all areas. These areas include voice, fluency, language, and oral mechanism. However, the way it was different is that in school settings, she focused more on articulation and language disorders, but then in the clinical settings, she focused more on swallowing disorders like dysphagia. And for direct access, so direct access is the ability of a patient to come to see an SLP without a referral, and SLPs do not have direct access. So patients are required to have a referral from a doctor prior to being evaluated and treated by speech and language deficits, and that's in the clinical setting. Now for the school setting, it's more of, they take a standardized test, and then if they hit a certain criteria, they qualify for treatment. And in Douglas County, where Mrs. Blackwell works, the standard score is 78 or below to qualify for treatment, while as in most counties, it's more of an 85 or below score to qualify for language treatment. And now I want to hand it over to Joey Lynn to talk about current issues in the profession.
So I'm going to address current issues in the profession of SLP. So the first one is discrepancy in the perception of when and where students should acquire knowledge and clinical skills. So most educators believe that they're preparing their students for the workplace with adequate skills, but clinical practitioners believe that their students need more skills. Reimbursement trends. So there's problem with reimbursement due to the fact that SLPs are usually paid through insurance or Medicare or Medicaid, and some services are going to be covered while others are not, which can affect payments. And there's also difficulty with finding clinical externships for students due to the fact that finding places for SLPs is getting harder and harder. And another current issue in the profession is large caseloads. So patients are not getting enough one-on-one interaction time between the SLP and the patient, which are leading to shorter sessions. Okay, we asked Ms. Sarah Blackwell what she thought a current issue in her profession was, and she said, autism and sensory processing difficulties have become widespread. Most of these children benefit from both speech therapy and occupational therapy due to the communication issues associated with autism and the sensory needs. Okay, so SLPs often work with other members of the healthcare team, and they work together as a team with other people. People that they commonly work together with are audiologists, physical therapists, occupational therapists, psychologists, and special educational teachers. We also asked Ms. Sarah Blackwell what a common SLP and PT interaction was, and she said PTs and SLPs interact frequently with the same patient. For example, if a child has PT as their first appointment and speech right after that, then when the child goes from one treatment room to the next, we often consult with their progress of goals and share any concerns we have. So an example is when a patient has a stroke. So a stroke is a common neurological issue that can change the way you move, feel, think, or speak. Patients who suffered a stroke may receive both PT and speech therapy at the same time to increase recovery, independence, and rehabilitation. Speech therapy may involve swallowing and word retrieval retraining, practicing speech sound production, engaging in role-playing conversation, and physical therapy may involve more of the physical concepts like regaining strength, coordination, balance, and control of movement. Okay, these are the references where we found our sources. Okay, thank you.